Bismillahirrahmanirrahim. Assalamu alaikum, everyone. Welcome to Preventative Health Lecture Series hosted by American Muslim Women Physicians Association. I will start the program with Quranic recitation first. A'udhu billahi minash shaitanir rajim. Bismillahir rahmanir rahim. Qul huwallahu ahad. Allahu samad. Lam yalid wa lam yulad wa lam yakul lahu kufuwan ahad. Next, I would like to welcome everyone who is online. Samreen, can you please move next slide? AMWPA was formally structured as American Muslim Women Physician Association as a nonprofit 501c3 corporation in 2008. Our mission and vision is, next slide, to improve the condition of women's health and provide a platform for Muslim women in medicine and other fields related to medicine to raise awareness in the communities regarding issues for the welfare of the communities and the family members. Preventative healthcare is our passion. Today, I'm very excited to announce our Heart Attack and Prevention lecture series. Our esteemed speaker today is Dr. Samreen Raza. She is a cardiologist. She's a clinical cardiologist with expertise in advanced cardiac imaging, which includes advanced echocardiography, which is the specialized ultrasound scanning of the heart, and cardiac CTs. She is originally from London, England. She earned her medical degree from the esteemed Imperial College School of Medicine in London, where she graduated with distinction and honors in medicine, clinical sciences, and surgery. She has been named Best Doctors by D Magazine for several years. She focuses on prevention of heart disease and women's heart health. Let me briefly introduce myself to you. I'm going to be your moderator. My name is Dr. Maria Viqar. I'm a board certified and specialize in general cardiology and clinical cardiac electrophysiology in Dallas Metroplex. The focus of my clinical practice is diagnosis and treatment of a wide range of coronary artery disease conditions, atrial fibrillation, syncope, heart failure, and women's heart disease. I perform complex ablation procedures, pacemakers, and defibrillators, and also perform diagnostic cardiac testing. Please ask questions freely in the chat box if you have questions during the lecture, and at the end, we would open the platform for all the questions and queries in your mind. Please enjoy this lecture by Dr. Samreen Raza. Dr. Raza, to you.
Thank you so much. So humbled by the kind introduction, and I'm going to just flip my slides, so bear with me just for a moment. And we want this to be quite interactive as a session. So if anybody has any questions, please feel free to enter into the chat. You can also message us privately as well, but I think it might be best if you just enter your question in the chat, and Dr. Viqar will be looking at the chat message, and I will also be looking. So we'd like to get to your questions. So we're going to leave some time for Q&A at the end, okay? And really, I would say any question is on limits. There's nothing that's you cannot ask, and I would rather have everybody able to ask and answer their questions. So with that, we'll get started. So I'm going to give you just a brief outline of what we're going to be talking about today. So we're going to be discussing risk factors for heart disease. I'm going to tell you about how to prevent heart attack. We're going to focus on some of the diet and lifestyle changes to follow for good heart health and some of the warning signs and symptoms of heart attack. And then we're going to launch into some questions. And like we said, we want to keep it quite interactive. So here's the truth. These are the figures. So heart disease is the #1 killer of women, no matter what their race or ethnicity. Some of these figures now, these taken from the CDC, but as you can imagine, the statistics become updated every so often. So we try to focus on what we understand clinically, but we know that heart disease can permanently damage your heart and your life. It's so important to understand this. And I think it's great to have lecture series like these where we can talk and raise awareness and understand more. And I'm going to kind of launch into the next slide. So we talk a bit about prevalence. So we talk about heart disease being the #1 killer of women, but it's really important because cardiovascular disease can affect really any age group, any population, but we're seeing so much more now, and we can talk more about that with regards to risk factors. I also like this this graphic. So this is taken from the American Heart Association, published by them. This is their 2023 update discussing heart disease and stroke statistics. What we understand, if we kind of break it down, I'm going to show you, if you guys can see my pointer, I'm going to show you the top left side. So we're talking about risk factors, one of them being diabetes or pre-diabetes. And we notice that there's such a large number of people who are undiagnosed with this really important risk factor for heart disease. 9.7 million adults have undiagnosed diabetes. We've got almost 115.9 million adults who have pre-diabetes, and many of those will go on to have diabetes, which, as we consider as a cardiologist, we consider that as a what we call CAD equivalent, so a risk equivalent for heart disease. The other thing we talk about is we're going to focus on America, although many of these statistics can be extrapolated or applied to many other communities, but we've got American data here. So we understand that about 224 per 100,000, this is a way that we talk about risk for heart disease, is related to reason is related to heart disease. So really important global health problem. It's so important. We talk about the number, we say every 34 seconds, an adult, someone in America will die of cardiovascular disease, and every 3 minutes or so everyone dies, someone will die of a stroke. So, you know, staggering figures. And I like to kind of put this up here because it really just gives us perspective. And then more information. So about 1 in 4 adults report, it's a minority, having adequate leisure, aerobic exercise and doing physical activity that is necessary for heart health and prevention of heart disease. And again, a staggering figure, around 47% of US adults are estimated to have high blood pressure. And this is a huge risk factor for heart disease, as I'm going to go into. Now, the problem is not just in men and women or adults. It's also affecting those in high school as well. So we've got this statistic: 1 in 9 high school students in the US used e-cigarettes in the past 30 days. And this is based on 2021 data. So we're talking about vaping or, you know, e-cigarette use. People think that that's a healthier, quote unquote, healthier alternative to smoking, but we're seeing so much related to that as well. And then we also think about, I focus on stress management and quality of sleep. And what we recognize, and again, this is information taken from the American Heart Association, for every 1 hour increase in sleep, so every 1 hour per night increase in sleep duration above 7 to 8 hours per night is associated with a 12% higher risk of total cardiovascular disease. So what we're talking about is having good quality sleep, which refreshes the body, is really important. And some of that is tied to stress level as well. And so this is very, very important. And then the other thing we kind of mentioned is about diet. I'm going to talk a bit about that later in the talk, but only less than 10% of US adults meet the criteria or the guidelines for how much vegetables and fruits they should be consuming. And this is based on data from 2017 to 2018. So, I mean, we could think about our diets, and it's really important. A lot of this is related to risk for heart disease. So heart disease is a now problem. I mean, me being a cardiologist, I talk about this every single day, but I can't stress how important it is for everybody in all fields of medicine to really be thinking about this. And if we leave things till later, it might be too late because we might already have developed signs or symptoms of heart disease. So what is heart disease? It's where the heart does not get enough nutrient-rich blood. It can happen both acute, which is over a short period of time, or chronic, which is over a number of years. Why does heart disease develop? It happens because of a process called atherosclerosis, which is where you get hardening of the arteries related to cholesterol and plaque, and other substances build up inside the wall, and that can then lead to blockage over time. And I'm going to show you, this is a picture of the heart, and a zoomed in picture looking at the blood vessel. You can see some cholesterol plaque build up in the blood vessel wall, which leads to narrowing. And then I'm going to show you another picture later on as well, but I just want to kind of take a step back and show you how complicated this whole process is. So we're talking about heart, but we're also talking about stroke and vascular disease. So you've got your heart, which pumps your blood throughout the whole body. It's a complex network.
Because they're making them food.
The blood is oxygenated from the lungs, and then it's transferred back to the heart, and it's pumped around the entire body to all the major organs. And what can happen is heart disease can develop in any of these areas, and that can lead to a problem. But when we think about heart disease, we're thinking about mainly related to coronary artery disease. I want to remind us about this complex.
Yeah, right. They're not going to go.
Blood vessels, and so you know, we worry about something called cardiovascular disease as a total. And so when we talk about
to bring him, huh?
we talk about the
You're
coronary.
always taking coffee.
I'm just going to mute this. I think the person who's unmuted. And we should be okay. So I'm just going to focus on the coronary circulation, which is the blood vessels which supply the heart muscle. So we've got three main ones. We've got two on the left side and one on the right side. We refer to these as the left coronary artery system and the right coronary artery system. We've got the widowmaker blood vessel, which is referred to as the left anterior descending coronary artery. And then we've got the right coronary artery. And so this, when we talk about heart disease or coronary disease, we're referring to heart disease blockage inside these main blood vessels. And then this is the illustration I wanted to highlight with you. So on the top, we have a normal healthy blood vessel. And on the bottom, we've got plaque and cholesterol buildup, which leads to narrowing of the artery, which then leads to abnormal blood flow. And in a serious and severe situation, you can get narrowed plaque and actually a blood clot that forms, which is an emergency situation. So this is where someone has a heart attack or a stroke. So really important. It's a medical emergency, very, very important to get medical attention. And we treat this very, very seriously. And I'll talk a bit about what some of those treatments will be, but I just wanted to show you the visual. So, but there's no quick fix. So we have to focus on lifestyle and prevention. Some of the main treatments of heart disease and focusing on prevention of heart disease relate to high blood pressure and cholesterol management. It's really important also to focus on a heart healthy diet and exercise routine as well. And like I said, we don't want to leave it till too late. So we do have treatment options for those more severe blockages, like I showed you the picture of earlier. So we've got something called stenting, which is where we actually physically open up the blockage. And then you probably have seen people who've undergone open heart surgery or bypass surgery, but this is in a case of significant blockage. If it's not treated, heart disease can lead to significant disability, which we underestimate actually, and death, of course, it can happen. So this is very, very important. I like this graphic. It kind of highlights some of the main risk factors for heart disease. So we've got smoking, obviously family history factors play an important role, aging. So as one generally becomes older, the risk for heart disease does increase over time. However, it is not all down to just a function of aging. So there's many things you can do in your lifestyle that can reduce your risk for heart disease. Unhealthy foods, having a high cholesterol, diabetes, obesity, being physically inactive, and stress level can also have an impact on heart disease. But here's some good news. Heart disease can be prevented or controlled, and the treatment includes lifestyle changes and sometimes medications. So we talk about what is your risk of heart disease. You know, we say, why me? Why now? The risk for heart disease does increase with age. In women specifically, we recognize that after menopause, the risk for heart disease can increase further. Now, some of this is related to the estrogen level, which drops after menopause. And we recognize is that women who are premenopausal, who have not had their menopause yet, have exposure to natural estrogen in their system, which does provide some sort of protective effect when it is related to heart disease risk. And after menopause, naturally, the person may be older chronologically, and so therefore the protective effect is gone and the risk can be increased in some women. Actually in women, but that risk is then individualized. But some of the main risk factors, and I want to really highlight this, so smoking, high blood pressure, high cholesterol, being overweight or having obesity, being physically inactive, having diabetes, and also family history of early heart disease in the family. We talk about this age cutoff of 55, but it really just depends on what your family history is. And so for some people, it may be younger, for others, it may be an awareness. Multiple family members might be affected by heart disease. And we talk about risk factors. The reason we discuss this is because multiple risk factors can increase and multiply the actual risk effect for an individual. So for example, women who smoke have a higher risk for heart attack compared to those women who do not smoke. Same thing goes with high blood pressure or hypertension. So people, women or men who smoke have a higher risk of developing heart disease or coronary artery disease, like I showed you with the picture of the heart before. And then I discussed in my first opening, statement to you guys, that diabetes has an increased risk for heart disease. But some of the lifestyle steps to control and prevent heart disease are really the things that we focus on. So it's really, really important. How can you go about reducing your risk for heart disease? So I think the biggest thing I say, have a heart to heart. Ask your doctor about your risk of heart disease. And I think it's really important, at least from my perspective, for us as patients or individuals to be empowered in our own health. And I think it's really important to draw up a list of questions before your visit and do some research ahead of time. I love it when I see somebody who comes to me with a list of what they're concerned about, because then we can address it more. And it's really nice because then the individual themselves is actually motivated to make those changes rather than, it just is a better treatment plan when both the physician and the patient are in partnership to reduce the risk and to kind of follow the treatment plan. I always give some tips to write down what the doctor says, or to bring a family member or a friend, somebody who can help you remember what's going on. But then also it's really important to be honest and open about what your lifestyle behaviors are, such as smoking or physical activity. These are the two big ones that I see. What are some of the tests for heart disease and how can we reduce the risk? So one of the big ones is high blood pressure. So we talk about high blood pressure, and you might be surprised to learn that a normal healthy blood pressure should be, or a whole high blood pressure, let's say, is more than 130 over 80. So this might be quite different to what many people think. Now, several years ago, the American Heart Association, American College of Cardiology released their guidelines, and actually some of the blood pressure targets were changed to what we traditionally thought. And so anyone who has a consistently high blood pressure in this range may have increased underlying hypertension and have increased risk for heart disease. Same thing goes with blood cholesterol. Now, these tests are checked generally by your primary care physician, or you may be checking up on your blood work. Blood pressure might be something you may be checking up on yourself. So it's really important to share. If you are having consistent readings above this range, you may well have underlying hypertension. So worth a discussion with a physician. Another few key tests for heart disease risk are, I talked about diabetes, so fasting plasma glucose, which is a blood test that's checked very, very widely on blood testing. And then I want to talk a bit about BMI, and actually importantly, I want to focus on waist circumference. So BMI is not a perfect measurement. However, generally speaking, it can give us a general estimate about what someone's general overall weight management profile might be. Okay, now there's many different factors. Ethnicity has a role to play as well, but the thing I focus a lot on is waist circumference. So I want to highlight this for my physician colleagues who are in the group, but also those who may be out there just thinking about their own risk for heart disease. So the waist circumference, which correlates to central adiposity, which is the fat that you hold around the main central organs and also around the belly, that is associated with an increased risk for overall heart disease. We understand this. And in women and men, there's different cutoffs. So if somebody has a waist circumference which is above 90 centimeters, that is equivalent to 35.5 inches, or a woman that has a waist circumference of more than 80 centimeters or 31.5 inches, these people may have an increased risk for heart disease if they also carry, depending on the way that their body is, the fat distribution is, and it's just a good marker that can be used. It's not perfect, but it's a very helpful marker that we do look at when it relates to being more specific as it relates to heart disease. And then some of the other tests for heart disease risk. So we talk about EKG, and then we talk a lot about stress testing. You've probably heard of doctors talking about. So EKG, or electrocardiogram, is a record of the heart's electrical activity. And we're looking at the heartbeat, how the heart is pumping, is there any arrhythmia, any heart rhythm irregularity? We get clues about high blood pressure, various different changes. We can tell a lot of information from the heart tracing. It can also look at if there's any evidence of a heart attack, many different factors that can be picked up on an EKG or an ECG. Stress testing is something as cardiologists we do a lot, but what we're doing is we're looking at the heart's performance under conditions of exercise. And the reason this is important is manyfold, but one of the main reasons is because in general life, people may not be pushing themselves as much as they think they are, And so, although many people, you should be physically active. However, a stress test is a set protocol of exercise, and we follow a standardized, so we can compare everybody of any age group on a set protocol. Usually we use a treadmill, but sometimes a cycle can be used as well. And it's really looking at the heart's electrical activity while exercising. And it gives many clues. And so one of the big things it's looking for is to see if there's any underlying blockage or any evidence of coronary artery disease, because that may show up as an abnormality on the heart tracing when you're exercising. And the reason why exercise is important is because it pushes the heart's performance so that it may unmask some things that may not be happening just at the low level when someone is not exercising or pushing themselves. I want to take some time to spend on this slide, but why do women not take action against heart disease? You know, and now this is an opinion statement, so not taken from looking kind of generally speaking. So a lot of different reasons why. Sometimes women don't put their health as a top priority. Some women still have the traditional caregiver roles. They're busy taking care of the family in the household, and these are all things that may take much of their time, and so they don't prioritize their own health. That may be a reason. Also, heart disease is still considered a man's disease, quote unquote. But we recognize, I just showed you the statistics for American Heart Association, you know, heart disease is the #1 killer of women. So really important, it's not a man's disease. It's as much a woman's disease as a man's disease. So I would urge everybody to think about what their risk is for heart disease. Sometimes women say that they're too busy to make time for lifestyle changes. And then we talk about stress levels. So some people might feel stressed already, and going and adding one more issue to take care of is, you know, seems a lot of stress and just something that they don't feel like they're able to do. But I would urge us to think about this and really empower ourselves to try and make changes and understand more. So how can you reduce your risk for heart disease? How can this happen? So I always say, begin today. It's never too late to make any changes. One big one to stress is if anyone is smoking, must stop smoking. And then it kind of comes down to following a healthy eating plan. So what we want to do is follow our
like friends are doing
eating saturated fat, trans fat. We want to focus on total fat, but also to moderate the amount of moderate the amount of total fat that someone is eating. The other thing is to think about avoiding processed food, junk food. These things have a lot of high saturated fats in them. Limit salt or sodium. So that's a really big, important aspect of lifestyle and diet, which relates mainly to high blood pressure, which is, as you know, a risk factor for heart disease. Include healthy fats, though, so you don't have to avoid fat altogether. So we're talking about things like olive oil, you know, avocados. These are all good sources of healthy fat, certain nuts. Avoiding fried foods. This is very important. And then being physically active. So exercising about 30 minutes, about 5 times a week. This is the goal for prevention of heart disease risk. But it's really important also to maintain a healthy weight. We spoke a bit about BMI. We spoke a bit about waist circumference as well. But it's really important to balance up calories and physical activity. Managing diabetes, a big one, because diabetes, as you know, has an underlying increased risk for heart disease. Managing diabetes can also help to reduce the risk for overall heart disease. And it's really important to focus on that if someone does have diabetes. And then taking medication if it's been prescribed, you know, talk to your doctor, understand what's the reason for these medications, and taking appropriate guideline directed medications is important. And then I put this on the last line, managing your stress level. Really important. We talked about sleep, disrupted sleep, chronic stress can increase the risk for overall unhealthy habits. Poor quality sleep is associated with many different factors in your day, in your life, in your health. It's really important. We talk about a condition called stress cardiomyopathy or broken heart syndrome. We refer to this as Takotsubo cardiomyopathy, many different terminologies. This is where there's an acute or sudden heart condition which is caused by a stressor, which then can have a physical impact, and it can mimic some of the signs or symptoms of a heart attack. And it can sometimes be associated in a severe situation with changes on the heart. So really important to understand this. And then what are some of the heart attack warning signs? So chest discomfort, which usually is in the center of the chest, lasts for more than a few minutes and sometimes has like a squeezing sensation. It can also feel like a pressure, which is uncomfortable, a fullness or a pain in the chest. But there can also be associated discomfort in the other upper areas of the body. So upper body, arms, some people experience in the neck or the jaw. Some people experience in the upper stomach or down both arms. So these are some of the symptoms that can be associated with heart attack. Another couple of warning signs. So shortness of breath. With or without chest discomfort. Some women experience shortness of breath as what we call the anginal equivalent, which is the symptom that some women experience, which is their sign and symptom of heart attack. But other symptoms such as breaking out into a cold sweat, dizziness, lightheadedness, nausea. What we understand is people talk a lot about the differences between heart attack signs and symptoms between men and women. But what we recognize is like that many of the symptoms are the same. But what we recognize is that that women sometimes have a lot of the associated other symptoms which relate to the second slide I told you about, you know, so they do have traditional chest pain and chest discomfort, but they have many of the other associated symptoms with their heart attack presentation. And it's important to call 911 immediately to survive a heart attack. We say in cardiology, time is muscle saved. So this is a medical emergency. You need to get emergency medical attention. Medical personnel will start treatment immediately. We always say if it's a heart attack situation, call 911 and get emergency medical attention immediately. Don't drive yourself to the hospital. People sometimes get embarrassed about having a false alarm, and uncertainty is normal in this situation. But what we want to do is make sure that someone is not having an acute medical emergency. And sometimes it actually is like a warning sign. Sometimes someone may be having symptoms, and actually then it is something to plan on and to try and plan ahead and learn what the warning signs are. And it may be an indication that you should get checked out. Here are some resources. If anybody's interested, they can take a look. American Heart Association has very good resources. There's also some women's heart health websites that you can go to. We also have some of the US American websites that also have some of the information about heart disease. And then I always say it all begins with you. So take one step at a time. You want to think about your habits and try to replace unhealthy habits with healthier ones. Think about eating for heart health, and we'll talk a bit more about that in the QA. Remember that calories do count, and physical activity is really important. And I would say to start by walking 10 minutes a day, and gradually you'll increase up to that 30 minutes of exercise 5 times a week, moderate physical activity level. How to keep going. So I recommend to focus on viewing the changes as a new lifestyle, not just a quick fix. Set realistic goals, and then having a partner or like an accountability partner is really important. Don't worry if you fall off the wagon or a slip or a change to your lifestyle. Reward yourself and how far you've come if you're being successful, and then be your own advocate. Like I said, when you're talking to the physicians, ask questions and seek information. Try and empower yourself with the knowledge. And like I say, you only get one heart. It's up to you to protect your heart health. So I recommend you start today. And with that, I'm actually going to open up to questions.
Dr. Raza, thank you so much. Excellent talk. We all learned many new things today. I will start with one question. Can you tell us more about, we think heart disease primarily affects men. What would you like to say about this for our women?
Yeah, so it's a really good question. I always say I love it when I see a woman in my office, because it is, I know how much it takes to get a woman there. And I feel like it's so good because it gives me the opportunity to talk to that person, that woman, about what their risk is. So heart disease is the #1 killer of women. It's not breast cancer. It's not ovarian cancer. It's not, anything like that. It's not to say that those conditions are not important. What we recognize actually is that let's take the example of congestive heart failure, which is weak heart muscle, right? Congestive heart failure has some of the poorest prognosis that you'll see compared to some of the worst cancers that you may see, so it's really important. I would say that if anybody has risk factors, it's really important to get those checked out. But no, it's not a man's disease. I know some of this also relates to like what you see in the media. You typically will see a man clutching the chest, you see it in the movies, you see it on TV show. We generally don't see women experiencing those same symptoms. I could also give the example of many celebrities, for example, that if you just have to go and take a look at recent media, and many of the women have died of heart-related heart disease. So I would say that it's definitely not a man's disease. And I think it's really important to understand that and for us to really take charge of our health.
Okay, thank you. We have a question from the audience about what is stress cardiomyopathy?
Stress cardiomyopathy, yeah.
Dr. Subo, or stress-related heart failure?
Yeah. So good question. So it is a specific cardiac condition. So it is basically cardiomyopathy refers to abnormal heart muscle function, okay? And it can be related to something which is more underlying, or it can be because of a reason. And so stress cardiomyopathy is a type of cardiac condition where an increase in the amount of stress hormones actually physically has an impact on the functioning of the heart. Now, this can present in different ways. So one of the conditions is like this thing called Takotsubo cardiomyopathy, which is where we call it apical ballooning syndrome, where the heart contracts abnormally because of all the catecholamines, adrenaline, norepinephrine, epinephrine, they're all in the system like high levels, and they're actually physically affecting the heart, and it can have an impact on the functioning of the heart. It looks very much like a heart attack. And actually it's treated like that because it presents so similarly, like can be crushing central chest pain, changes on the EKG, the heart tracing, changes on the blood work in the hospital. So we generally will treat these patients with taking them to what we call the cath lab, which we're looking at the heart blood vessels, and we see this very characteristic sign, and usually the coronary arteries are open, there's no major blockage there. But it can be related to stressful situations. It can be typically related to acute stress. So you know, you see people at funerals or sudden bad news, severe emotional stress. It's usually a very acute condition. I hope that answers the question.
It does. Thank you so much. Somebody has asked, we have covered this question already, but I would like you to allude a little bit. They asked if typical presentation of heart disease different in men compared to women.
Right. So what I would say is that there is a lot out there which kind of people talk about the symptoms for heart disease or heart attack are different, quote unquote, in men and women, you know? And I want to, what's dangerous about that statement is that I think women, the takeaway is that women think that they don't have the same symptoms as men do, or typical symptoms for heart disease, for heart attack. What I want to say is that typically when a woman is having a heart attack, they will have the classic symptoms, so chest pain, chest discomfort, shortness of breath, those types of things. But a lot of women have a lot of the associated symptoms, so things like arm pain, fatigue, lightheadedness, dizziness, nausea, you know, those other symptoms. And I also think some of it comes down to on the medical side as well, you know, so we need to also understand and really recognize what the symptoms are and communicate those effectively. I think some of it might also come down to communication differences as well between the two genders. But the symptoms and signs are very similar, and I don't want a woman to disregard like chest pain, for example, as something else when actually it could be a typical symptom of heart disease.
Okay, you mentioned high cholesterol in your talk. What is the good cholesterol and what is the bad cholesterol? And then my next question would be, how do you fix or improve your good cholesterol?
So good question. We talk about total cholesterol, which is the one, generally speaking, we'll check something called a fasting lipid profile, which is blood test, which is done without having eaten anything, because your diet can actually affect your cholesterol level. Like when you eat something and you check your blood test, it can have an impact. So total cholesterol is like the big number you get, and it's divided into some subcategories. And so one of the things is that we talk about good cholesterol and bad cholesterol. So when we talk about this, it is the good cholesterol relates to HDL or high density lipoprotein. And then the bad cholesterol refers to as, we refer to as LDL or low density lipoprotein. Now, the things that you can do are, number one is lifestyle, you know, so we want to talk about good, healthy diet, heart healthy diet. We talk about avoiding processed food, junk foods, avoiding foods which are saturated in high saturated fat content, those types of things. But we also want to focus on, you know, if you do have like underlying genetic factors, or you've tried the lifestyle changes and you still have a high cholesterol level, then you may need to take medication. That's one thing to have a discussion with your doctor about. But things that you can do are modifying your diet. So like we said, avoiding processed food, avoiding junk food. I also talk about dairy products, you know, switching to non-fat, low-fat where possible. You know, that's very, very important. Exercising is very important too. That can actually help. We talk about reducing your bad cholesterol and increasing your good cholesterol. These are all things. Some people have a genetically higher good cholesterol level. And sometimes really the medication is really helping more on the bad cholesterol side.
Okay, thank you so much. We have a question that if you have a clot in one of your heart valves, can this be dissolved by taking medication?
Good question. I think a very complicated question. So I'm going to kind of give you a very, very brief kind of high level answer, because I think, first of all, if you have a heart valve condition, like you've had open heart surgery or you've had a valve replacement, it's a very, very important, significant heart condition, which requires opinion and follow-up from a cardiologist, in my opinion. And blood clot on a heart valve is an extremely abnormal situation, which requires imaging. So we do sometimes check echo, but it may require blood thinner medication. in some types of heart valve conditions, you have replacement of the valve. And actually, sometimes they are either mechanical valve, which are made of metal, or we have the bioprosthetic or tissue valve. And the different types of valves are treated in different ways. So it's a very general question, but I would say mainly there are treatment options, but it becomes quite complicated.
Yes, thank you. So yes, any problem with heart valve should be followed up with a cardiologist with echocardiogram, which is advanced heart imaging, and it should not be taken less seriously.
Yeah, the other thing I'll mention just on that subject is that sometimes if you see a cardiologist, they'll know what to do. However, sometimes some modalities like CT imaging can be helpful when it relates to artificial heart valves and problems related to that.
Okay, excellent, thank you. Is irregular heartbeat harmless?
Good question. I'm going to let you answer that question.
So I would say that any irregular heartbeat should be taken seriously and should be worked up. If you have slow heartbeat and you're used to it, I think if you see a cardiologist and then they establish that this is your normal heartbeat, your heart rate runs in 50s, this could be okay, like athletes live on a slower heartbeat. But if all of a sudden your heart rate has been in 70s and 80s, your pulse been high, and then all of a sudden it is slow, then it could be some medication you're taking. It could be one of the supplements you're taking without knowing that this is affecting you, or it could be irregular heartbeat, which could be atrial fibrillation, which has the potential to cause strokes. So that needs to be checked. And as you mentioned, as Dr. Raza mentioned, that EKG, electrical activity of the heart, strip tracing is very important. So any change in the heartbeat should be mentioned with the doctor, your family physician, or referral to the cardiologist.
Yeah, the other thing I'll say is that as a cardiologist, it's very easy for us to understand more about that, you know? So some people might have a irregular heartbeat that's been noted, you know, and it's not hard to actually understand more about what that means, you know? And so we can run like monitoring of the heart. Some people wear like Apple Watch and Fitbits, you know, there's many different wearable technologies, which is a whole separate discussion, you know. And so many of these pieces of information we can use to try and understand more. So again, it comes down to like the principle of if you have some concerns which relate to your heart, it's very, very much worthwhile getting checked out and talking to your physicians about that.
Okay. Somebody asked, can partly clogged arteries be unclogged with regular exercise or change in diet?
It's a good question. I would hope so. Yeah, that's the reason we focus on lifestyle. You know, we talk a lot about medication. That's the whole idea. You know, good healthy diet and exercise is meant to help. Yes, it's meant to help. Now, is it going to magically make the plaque disappear? Unlikely, but however, it's definitely a beneficial thing you can do, which is along with medication, healthy lifestyle. So I would hope so. Yes.
Okay. A lot of women in our community complain of pain in the legs. Is this a sign of aging, or could this be peripheral arterial disease? Would you tell us more about
It's a good question.
Pain in the legs?
It's a good question. I think I will say a lot of it. So generally speaking, pain in the legs sometimes can be an underlying symptom of what we call peripheral vascular disease, which is blood vessel disease, which is not in the heart or in the brain. We're talking about down the legs. So sometimes people can have both arterial on the artery side and vein disease, which can have these similar type symptoms. Some of the treatments are, you know, obviously evaluation with a cardiologist or your physician is important, but a lot of it, from my viewpoint, I see a lot of it sometimes is related to lack of fitness. You know, people are just not exercising enough. And so therefore, when they start doing something, they experience pain in the legs because they're just not used to that level of physical activity, you know. Even for peripheral vascular disease, which is blood vessel disease in the legs, one of the treatments that we recommend is actually graded exercise program, you know, so exercise and walking specifically, because what that does is it helps to open and build, you know, the health of the blood vessels and also build what we call a collateral circulation. So even if there is a blockage, then it kind of helps with other blood vessels that grow around where the affected blood vessels are. But that being said, you know, there's very simple tests that we do as cardiologists. You know, there's something called an ABI, arterial brachial index, which is like a blood pressure check of the legs, which can be done. So if anyone is having persistent symptoms like that, it can definitely be checked out.
Awesome. This is great. So someone who has a very strong family history of heart disease, is there hope for them? Can they prevent their heart problems from happening?
Yeah, I would say choose your parents wisely. Really important, you know. No, it's a joke. So it's not all lost. You know, some people do have very, very bad family history of heart disease, like multiple family members, early age, you know, heart attacks, strokes, stenting, but it's not all lost. You know, there's so much of an effect of lifestyle and diet. So we talk about genetic risk factors, and yes, it's important to focus on those. However, there's so much that can be achieved by healthy lifestyle. So no, it's not all lost. Actually, sometimes I talk to many people who have strong family history of heart disease, and they make healthy lifestyle changes and can really change the outcome. And so it's very, very important. It's important not to be discouraged by the fact that both parents or multiple family members might have a risk for heart disease or have had heart disease or strokes. Much can be achieved through healthy lifestyle.
Thank you. So if someone is prescribed a medication, how important it is to be compliant every single day with their medications, or can they just get away with it sometimes?
I know, it's a good question. I always say it's always worth having like an honest and open discussion with your physicians, you know, because first of all, it's very important for you to understand why you're taking the medication. You know, what is the reason? Because there might be an alternative, there might be another lifestyle intervention that you might choose instead of the medication. But it's unsafe to just stop medication on your own, you know, without any supervision, because that could have a impact or some other adverse effect for you. So I think it's always important to have a physician who's overseeing that. That's just good medical practice, you know, to have the opinion of a physician that understands your case, understands all the information related to your medical history, and also your preferences, because it's very individual, at least from my perspective, you know. So it's important. And you know, a lot of people they have issues with a specific type of medication, and there may be another alternative, or maybe stopping the medication is a good idea. But then I always say you have to replace something with something else, you know. So for example, in the case of like cholesterol management, you know, some people might not want to take medicine for cholesterol, but then we need to really focus on whether that's safe, you know, number one. The number two is if it's beneficial for some other reason. And then the third thing is really, is there another lifestyle change that can be made? You know, we can't just stop medication and just hope for the best, you know. You've got to do something else, like exercise or healthy lifestyle, healthy diet has to be replaced, you know.
Okay, awesome. So how often people should get cholesterol screens? So American Heart Association recommends after age 20, you should check it every 5 years. What is your advice?
Yeah, I recommend that. Yeah, I think a lot of this is handled by our colleagues in primary care as well. So would love, you know, the opinion of anybody who's in the audience who is in the primary care sector. But generally speaking, let's talk about like the Medicare population. You know, that everyone has a Medicare wellness examination, and part of that is lipid profile is part of it. You know, I think if you have a family history of heart disease, that might warrant a lipid profile or check on risk factors earlier. You know, but yeah, I'd follow the American Heart Association guidelines. I agree with you.
Okay, awesome. Thank you so much. If anyone in the audience has questions, we have opened up for everyone, so ask away, feel free.
Okay, we had a question about fats, right? So we talk about avoiding saturated fats and fried foods, but the question is really about what type of oil to cook with. So olive oil is very good. Avocado oil also is good. Avocados as the actual fruit, is it a fruit or is it a vegetable? I can't remember now. It is a good source of healthy fat. So that, I hope that clarifies the question. But both avocado oil and olive oil are good fats, good oils to heart healthy, which can be used as part of a balanced heart healthy diet.
Okay, thank you.
Okay.
So we have another question.
Okay, so a couple of medications on.
So what is the recommendation on diabetics taking cholesterol medication as prophylaxis?
Question. Yeah, I think a lot of this discussion, you know, by the time people come to see me as a cardiologist, a lot of it is counseling on risk reduction for heart disease. And like I mentioned, diabetes is what we call a CAD equivalent, you know, so the risk factor is so high to that there is some general benefit in reducing the cholesterol number. Some people, you know, what we recognize is, so lifestyle changes, like I said, are really important, but most diabetics actually would benefit, depending on what their cholesterol level is and how long they've had diabetes for, likely would benefit from statin therapy, which is a cholesterol treatment. I don't really focus on the word prophylaxis. That's not really like the way we think about it, but to think about it in a different way, because the risk for diabetics is so high, we talk about indications for statin therapy, and depending on the person's individual risk, we talk about other risk factors, their cholesterol profile, how long they've had diabetes for, what their age is, if there's any evidence of other plaque buildup, you know, they've had an abnormal calcium score, which is, you know, heart, like a screening test for heart disease, or if they've had a stroke in the past or other risk factors, then likely they would benefit from statin. Okay. And then there's a question about what is the risk of stroke with cholesterol medication. This is such a impossible question to answer, you know, because it's very individualized, you know. It depends on it just is. There's no like sorry, it was like another question. I think should we wrap it up?
Yes. So someone asked, how low should cholesterol go with the cholesterol medicine? I think there's no great right answer for that. But the lower cholesterol, if you have history of coronary artery disease, the current guidelines do recommend your LDL level should be less than 70 milligrams per deciliter, or there are some newer studies who even suggest even a lower LDL cholesterol number for plaque regression and not progression of heart disease.
Yeah, the other thing is we always want to talk about risk reduction, you know, like cardiovascular risk reduction. And what we recognize is that certain types of medications help reduce that risk more. Statin medications are one of those types of medications, but we also have like the injectable type medications. So we're talking about like Repatha, PCSK9 inhibitors. These are all types of medications that can be used to try and reduce the cholesterol level further to targets when someone has a really high risk for heart disease, you know, heart disease for the future. So we're talking mainly about, you know, reducing that cholesterol level down, reducing the person's risk level. And so it really is like a very individualized target. But what Dr. Viqar was talking about was those patients who've had a heart attack and what their number target is going down, you know. So it very, like I say, it's always really good. Like these forums are not meant for personal medical advice. We had very good questions, but hopefully you found this all informative. And what I would say is take these points. A lot of what we talked about, what I talked about today, is healthy lifestyle, diet, risk factors, you know, awareness for what heart disease risk is. And I think we can all apply this to ourselves, so we can think about what our own personal risk is, and then also apply this to many of our patients so that we can help take care of them and reduce their risk as well.
Dr. Samreen Raza, thank you so much for this wonderful talk. Preventative healthcare is the best treatment. So with this, I would like to end the program, and thank you everyone for attending the program. And thank you so much, Dr. Raza, again for joining us today.
Thank you for moderating, and it was a pleasure to be with you all. Thanks for the invitation.